So what I'll have you do is let's lay on your side, on your left hip, your right side up, please. To perform this adjustment, I'll have the patient lay on their sides. We're gonna bend the top leg here and keep the bottom leg straight. Pull the arm out to on your shoulder, and let's scoot your hip just a little bit closer towards me. And then what I do is I'm gonna contact her shoulder or her elbow just to help get some traction. And my hand is gonna be right on the ilium on the right side. I'm just gonna gently roll her towards me, and I'm gonna apply a pressure with that left hand. Just like that, perfect. That's the way we can adjust the SI joint on the right side, just to help relieve nerve pressure, get her mobility back to normal, and help relieve SI joint pain.